My name is Vanetta Jackson, and I'm a medical assistant instructor here at Career Point College. A medical assistant is an individual that can help out with a lot of the procedures. They're first line when it comes to the patients. They're the ones that may check them in. They will get their vital signs. They will do the patient interview. Basically kind of an assistant in the sense of when the CNAs need help, when the nurses need help, when the doctors need help. Medical assistants can work in various doctor's offices. They can work in your family doctor office, maybe pain management clinics, surgical clinics with in and out surgeries. They can also work in home health care. They can work in nursing homes. As a medical assistant, it can be a stepping stone within the healthcare field. What they can do is, once they got their foot in the door, when they have successfully completed this program, they can move on to the LVN program. They can also progress forward to the RN program. They can definitely move forward all the way up to BSN with an RN degree if they choose to. So when a student comes in on the first day, well, they're going to receive all their information on the tracking sheet, the syllabus, the procedure sheet. Then they'll start getting their lectures for that chapter, wherever we're sitting at in the class. Once they get the appropriate lecture is when they can move on to their procedures. Some of the procedures they can learn how to do and that they will learn how to do are your phlebotomy, so your blood draws, your injections, during their urinalysis, they'll learn range of motion, positioning and draping procedures. So these are all things that they'll learn. As they go on for about a month and a half, they successfully complete the course. A simulation lab, it gives them the experience that they will come across in the real world. Several different simulations that we have is ambulation, which is walking with the patient, helping them guide, especially if they're unstable on their feet. We have our mannequin arm that we use for blood draws, so that way they can get that simulation, get that feel for what it's going to be like when they're actually drawing blood from their patient. Same thing with the blood pressure. We have the simulation lab where it will kind of give them experience so they know what they're listening for when they're actually getting a blood pressure, so that it can be accurate, since that's a very important vital that they need to know. What makes the medical assistant program at Career Point so special is the flexibility. They're able to maybe come in the day, come in the night, work around their child care. It allows them to have both successful education and still be able to maintain their life. So a lot of those stresses that normally come with going to school can be alleviated just by attending Career Point. So as part of the Affordable Health Care Act, it is now mandated that the medical assistants need to be certified, and that Career Point College will pay for 2 attempts at the exam. I take my students' success very personally. Whatever they need, whenever they need it, I'm available. They can call, text, they can send me an email. I have everything directed personally towards my phone, so they're gonna get a response. I make sure that they have every tool, opportunity, time, whatever it is that they need to succeed.